So you are pregnant and you have a positive ANA, antibodies being produced by your immune system attacking your own DNA, your own genetic material, anti-nuclear antibodies, antibodies attacking your own nuclear material. Well, not a great place to be because we know that we pass on so much to the developing child during pregnancy, but we also care about the mother who's pregnant as well, right? And so what we like to do, of course, is start to reset the immune system during the pregnancy, trying to get that ANA to go negative during the pregnancy, or at least get the immune system healthier and healthier as the pregnancy develops, which can be challenging because as a pregnant woman, you are getting so much of your vital energy, nutrients, everything is such a challenge for your immune system during pregnancy. We're asking it actually to heal during a time that is very difficult for it just to keep doing this work that it's already doing. And so, fortunately, all the things that we would want to do for the most part to help reverse an autoimmune disease would be something we can do during pregnancy. That's going to help not only you as the pregnant woman, but help the developing fetus. Now, there's a couple different ways that things are passed down from generation to generation. One is through epigenetics, the things that influence gene expression without changing the genetic code itself. And we have a lot of bad genes every cell in our body, got to turn them off. Got a lot of good genes every cell in our body, got to turn them on. Well, when you have a positive ANA, an autoimmune disease, Bilstrom's nuclearitis, or other autoimmune diseases, um, including the ones that might carry positive ANA or any autoantibodies, is you want to start addressing this and turn off the bad genes, turn on the good genes in every cell in your body. So those are things such as making sure your vitamin D is just right. The vitamin D receptors are sensitive, making sure that your good bacteria in the gut are making short chain fatty acids such as butyrate, which works almost exclusively through epigenetics, flipping genes on and off in every cell in the body at the same time. Or we actually use that as a supplement. For example, we really try to get your system in a good place so that your immune system is very robust. And we have now optimized epigenetics in you. But by doing that, we are now optimizing the epigenetics in the developing child. So they are going to have healthier epigenetics once they're born and are outside of you because of what you did before you actually had the child. Now, in the perfect world, we'd like to optimize epigenetics in both the mother and the father before conception, but that's okay if we miss that opportunity. We can do it during pregnancy, and then we make sure we do some really great epigenetic stuff for the developing child after they're born. And the other thing that gets carried from generation to generation, driving health in our offspring and future generations, or unfortunately driving chronic disease, is the intestinal microbiome. The intestinal microbiome is actually passed down from generation to generation, from the mother to the child, or if you will, the grandmother to the mother to developing fetus before being born. And we need to optimize all the four microbiomes in a woman, ideally before she's pregnant, or optimize all four microbiomes during the pregnancy so that the child has the healthy microbiomes even before they're born. So the four maternal microbiomes that we want to optimize, ideally before conception, but during pregnancy, if that's our first opportunity to do this, is intestinal microbiome, vaginal microbiome, blood microbiome, and oral microbiome. And what that's going to try to set up is a healthy fetal intestinal microbiome. Yes, a fetus before they're even born is setting up an intestinal microbiome, hopefully a lot of good, not a lot of bad, before they're even born. But also this is tied into the placental microbiome, the mix of good, bad bugs within the placenta, which is the communication divider between developing fetus and the mother. There has to be excellent communication back and forth, a really healthy placenta to optimize fetal development and ideally put the child in a great place to live a long, happy life because you set them in a good place so early on. So the intestinal microbiome determines the blood microbiome and the vaginal microbiome. The oral microbiome is the centerpiece of how we develop a healthy placental microbiome. Yes, the oral microbiome, but also the oral microbiome helps determine the intestinal microbiome. So we want to get rid of any bad bugs in the mouth. Historically, the science is very clear. We have bad bugs in the mouth. It can be gingivitis, it can be cavities, it can be oral health issues. Those bad bugs will get into the bloodstream from the mouth and increase heart attack and stroke risk. But we don't want those bad bugs in the mouth that can do that, but we don't need those bad bugs in the mouth getting into the intestine, adversely affecting the placental microbiome during pregnancy. We want to optimize that. And then we want to optimize the maternal gut microbiome, intestinal microbiome, which will then optimize the vaginal microbiome, the blood microbiome, and the fetal microbiome, intestinal microbiome is developing, including then, because you've optimized the vaginal microbiome, when the baby's delivered vaginally, comes through the vaginal vault, there's going to be the perfect mix of good, bad bugs in the vaginal vault that will seed the baby's mouth and behind as they're being born, delivered through the vaginal canal, then migrate up and make an even healthier intestinal microbiome after pregnancy. The science is so fascinating about this stuff. I hope you enjoyed it.